Yes, my two dogs in with me.
That's always nice.
Yeah.
Hi, everyone. Thanks for joining us this evening. Sorry we're starting a little bit late. There's a problem with the link for the StreamYard tonight, but thank you for joining us. I'm Nicky, and I'm thrilled to welcome back Dr. Debbie Torraca. And who is this?
This is Otter. He says hi.
Hi, Otter. Oh, so cute. So Debbie's come back. She spoke to Hannah. Was it sometime earlier this year or last year about degenerative myelopathies?
Yes, yeah. So we've spoken a couple times, and then we just saw each other at the rehab conference.
Yes.
So that was lovely to be over in Cambridge, and yeah definitely. So,
but you're back home now, back in Connecticut.
Yes, back home. But my younger daughter, my 16-year-old, went with me to Cambridge, and she didn't want to leave. She loved it. So
amazing. Oh, that's good to know.
Yeah.
Good. And so I'm going to tell you, well, I'm going to ask you to just introduce yourself a little bit, but you do a lot. You're a very busy person, aren't you? So I don't know what I wouldn't want to guess what you would say your main role is, but you're a certified board orthopaedic specialist.
Correct.
Canine rehabilitation practitioner,
Correct.
teacher, lecturer, so many things, and a couple of things that I know Hannah touched on last time with your Toto Fit as well, your business doing that. But what we're going to talk about tonight is rehabilitative approach to osteoarthritis. But before we go any further, I'm just going to, before I forget, because I will do, just ask everyone just to, if you can join us for our big walk later on, in a few days, actually, in September, we're going to be doing a virtual big walk where there's going to be lots of information online, competitions, loads of things to join in. So it's a really lovely way to support CAM. It's only £10 to join the walk. So I just want to put that out here right now, because it's really important that everyone, if you've ever gained anything from watching CAM, going on the website, or anything like that, please support us and please join us for the walk. And if you'd like some more information, I'm going to put the link in the comments as well. And if you have any questions, just please do let us know. So I'm going to put that there now. So I'm just going to take that back down and we're going to move on. So Debbie, would you like to just introduce what you're up to at the moment and what your main job is?
Definitely. So, gosh, my main job, I always laugh, but so I own Wizard of Paws, a rehabilitation and wellness clinic, which is in Connecticut, and see a variety of clients, patients throughout the day. Anything from, certainly we see a lot of osteoarthritic patients, ranging as early. I had a 10-week-old puppy in earlier already with elbow dysplasia. So of course that's, we're going to be looking at the OA component of this and quality of life and making sure he lives a wonderful life, up to all of our wonderful seniors. And my clinic is fairly busy, which is wonderful. I have an incredible staff and, it's wonderful. So that's one part of the component. I speak for the new program with Northeast Seminars and North Carolina State University, the CCAT, the Certified Companion Animal Therapy program. So we're so excited about that. Redoing or actually starting for new with this whole rehabilitation program. So that's exciting. And I also teach with a Fenzi Dog Sports Academy and removing the fitness trainer program off to another site. So, which is all exciting. And I firmly believe the more educated people are, regardless if you are in the vet field, if you're an owner, if you're a wannabe owner, the better off our dogs are. And, and our other animals. I have a horse and my younger daughter we have various creatures at home. So, it's always, wonderful to look at and
keeps you busy.
definitely keeps us busy. So
Yeah.
it's all great. Yeah.
I mean, I guess it comes to when you first start doing rehabilitation, it's a massively increasing, growing field. So you're going to need more people everywhere in Europe and the States to be doing these things. So through teaching, like you say, the more people that know about it, and
Absolutely.
it becomes more accessible then as well, doesn't it?
Absolutely. I've probably been doing this a little over 25 years, and I look at where it was the train wrecks of post-operative cases where no one knew what to do, and
Yeah.
now we've come so far with preventative,
Mm.
issues. And it's lovely to do a lot of virtual consults with people that want to help their dogs with pain, with looking at, we often assume aggression is because the dog is just plain aggressive, and we
Yeah.
really overlook the pain aspect. And
Many of these aggressive dogs have got some kind of underlying pain.
absolutely, and just understanding that they're in pain, and can we make them feel better, can we get them stronger through this multimodal approach, and then help them. So yeah.
I mean, the great thing I think with what you do is that it's not prescriptive, is it? So it's not like everyone comes in and you can be like, okay, this is what we're going to do, bang, bang, bang. Every case is going to be different,
Absolutely.
and that's why it's an approach rather than a treatment, I suppose, because it just varies.
And it's so true with, I personally hate strict protocols. Your dog has hip dysplasia, this is what you do, because it is, as you said, every animal is going to be treated as an individual. And if the dog has hip dysplasia, well, that may be one of their problems, but they also have issues, say, with their back, or their one of their front limbs, or they're overweight because they're not moving as much, and there's a whole system. So it's really looking at the individual dog, and looking at their the owner's goals, and what they want, and all of that sort of stuff. So
yeah, I think that's an important point, the owner's goals, and also the owner's expectations and what they can realistically achieve. Because I know the last time you were speaking to Hannah, you were talking about diagnostics and kind of saying that just because you have everything doesn't mean that's going to be appropriate for every single case. And that applies to the management as well, doesn't it? It's not, it depends what you're able to do as an owner, because a lot of rehabilitation is going to be very hands-on at home.
Right, exactly. And it's true. My staff and I often talk about the individual dogs and what the dogs need to be able to do at home, for the owners. So sometimes it's not realistic for an older couple to be lifting 100-pound dog. So can we get that dog up and walking, and all of that, and what will work for them? So absolutely.
Yeah, challenging, but frustrating, and challenging, and rewarding as well, I suppose.
Absolutely. And I love all the dogs I work with, and I often look at the dogs, at the show dogs, and watching their accomplishments and all of that sort of stuff. But there's nothing more heartwarming to see a dog that has been struggling to walk, due to osteoarthritis and the ramifications, and to have the owner say, "Oh, I'm so glad that he ran to the door to greet me, for the first time in years, or jumped on the couch and slept with me." And that's, I look at my own dogs, and one of my previous dogs who was older, and I would always get so excited when he would counter surf. And he feels better, and all my dog trainer friends would say, "Oh no, that's awful." I'm like,
it's a really bad.
Wonderful. Like, it's a good hip extension and lumbar extension.
Yes.
All of that. So absolutely. You look at their quality of life, and yes.
So when you get a pet referred to you, or the owner comes in and their pet's been diagnosed with osteoarthritis, where are you starting? You doing your own workup and finding, because like you already kind of mentioned about the compensatory discomfort and referred pain. So you kind of have to start from scratch.
Yes. So definitely. So always starting with a good history, and I joke, but it's really not a joke. We don't want to tell stories from pictures. So if radiographs or x-rays have been taken and we know that the dog has this and that and all of that other stuff, that may not fit what is really going on.
Yeah.
So I always look at a history of what they have been doing and maybe what they've stopped doing. Any changes in the past 6 months. We do a functional pain scale. So how would the owners rate their function? Has their activity been decreased or anything like that? And you're thinking about chronic pain when people, dogs, other animals, when they've been in pain for over 2.5, 3 months, there's been a change in the nervous system. So, asking about when this started. And once I have a good history, really start with just observing the animal. So watching them do functional movements such as, just walking around, sitting, standing. Are they comfortable? I always like to see a dog be able to stand for 10 seconds, no matter if they're 8 weeks of age or 18. Can they stand squarely or evenly for 10 seconds? And, is there any compensation? Are they shifting their weight? Or maybe they don't have the strength, to do that.
Yeah.
So once that's, have a little bit of an idea, I'll do a formal gait analysis, which on a dynamic gait system, that'll determine how much weight they're putting on each limb, their stride length, their step length, if they're shuffling or anything like that. And of course, a visual. So we're, seeing and all of that. And then begin with a hands-on approach. So going through determining if there's any areas of discomfort and like kind of just a body scan. So it's amazing sometimes, what can be missed.
I think and because you have all the time as well as all the experience.
Right. So is there
so
anything else
important.
going on? Yeah.
So important to get a baseline, isn't it, before you start anything?
Exactly. And then looking at their range of motion. So functionally, we know what they can do, but how much motion do they have? Where are they lacking? Or are they compensating? And, certainly looking at if there's pain or discomfort anywhere. And, really, the initial visit, my goal is always that multimodal approach. So if we can make them feel better. So I always tell owners our goal is going to be to get them to feel better. And then we can apply it with helping with increased range of motion and strength. Because if we don't have that on board, if we don't get rid of the pain or inflammation, we're not going to get them, better. So, yeah.
So are a majority of the arthritic patients that come to you, are they already on some kind of pain relief and management before they come?
A lot of them are, and then certainly factoring that in, is it enough for them? Is it, sometimes is it too much? Or many owners want, a lot of times their goal is to get them off an anti-inflammatory or an NSAID. So we talk about that chronic pain versus acute or sudden pain, and what we can do to mitigate that and help reduce that. But most of the time that is one of our goals, and if we can, we can. And certainly talking about appropriate supplements and diet. And it's just a fact. Everyone, and especially with the pandemic, everyone is like gained weight, decreased movement and all of that sort of stuff. But if the animal's not feeling well, then they're going to move less, they're all of that. So that factors in. And are they on the appropriate diet? So, certainly, what is their home, like, are they sleeping on a good bed? Are they, do they have to walk across slippery floors? And, looking at all of these things that sometimes we'll forget about.
Yeah, I mean, that's one thing we talk about a lot on CAM, is that probably one of the biggest thing you can do for your pet is to keep them in a good body condition and not overweight. And no matter what you throw at them, if they are overweight, it's not going to be as successful.
Right.
So you may as well invest that money and time.
Yeah.
And actually, it's the cheapest way as well of treating, just to lose the weight.
Definitely.
Will make the biggest difference
Yeah.
alongside everything else.
And and I do think it's difficult because most owners don't understand what steps to take. They're told their dog is overweight, but they really need some answers. What can I do? And, just pointing them in the right direction and
guide them through it. Yeah.
Helping with them. So that plays a significant role.
So when you see a dog and you're starting, I also just quite like to ask you a few questions about the puppy that you saw as well this morning. But when you see a dog and they start their journey through rehabilitation, so you're taking all your histories first, and then would you then send them home with stuff to do first before you then see them back, or what are you doing next?
Yeah, so good question. So definitely the initial time we're going to treat them, use whatever tools we think are going to help and at least get them started, but then giving the owners some homework. So I usually like to give the owners 2 or 3 different things to do at home. And it could be stretching exercises. My puppy jumped up. Stretching exercises, some baseline core exercises. Sometimes depending, we may talk about like a home laser or a CC, using one of the CC products or something like that to, help treat the dog at home, or heat, ice, that sort of stuff. But that's definitely, I always tell owners what they do at home is a lot of times more important than what we do at the clinic. So we see the dog once or twice a week.
Do you? Quite frequently then?
Yeah, but that's not all the dogs. I mean, some of them are traveling from a distance, may only be seen once or twice a month. So what they're doing at home is very important, and we'll keep in touch and make sure we do try, especially with the whole pandemic, videos, so the owners understand what they're doing at home and that sort of stuff. So that's been very helpful. And then definitely every time they come in, we're doing it could be a lengthy reassessment or a longer reassessment, just depending upon, what's been happening, but certainly checking in and how did they do after our first treatment? Were they tired? Did they feel better? All of that sort of stuff. So, yeah.
So what sort of therapies are you most commonly using for your arthritic dogs? Because I know it probably differ from the ones that post orthopaedic surgeries.
So we may use a combination to making sure that the dog is, there are no contraindications, but photobiomodulation or laser. Also pulse shockwave therapy I found to be very effective with osteoarthritis. A lot of hands-on manual work of stretching, massage, joint mobilization, all of that sort of stuff. And we want to always tend to go on the lighter side, so not to overdo it with, especially with the first visit. And definitely if they're sore, using ice or even like moist heat to help them relax, and just depending upon their anxiety and their discomfort, all of that.
I mean, it's hugely time consuming, isn't it? So anyone that's going to consider doing rehabilitation with their pet needs to accept that this is going to be like a daily thing that you have to invest in. It's not like you turn up at the clinic.
Absolutely. It's, rarely, I mean, we love to see like the overnight change, but that's not going to be permanent. So it's definitely as the dog starts to feel better and they get stronger, but it is a continued, it takes work every day. And, I always say that dogs are such mobile creatures. Movement to them is life.
Yes.
So once we can help them with that movement, then they start feeling better, and
Yeah.
keep them going as long as possible in a pain-free way. So
Yeah. So the aims of rehabilitation are to reduce the inflammation and the pain. So how exactly, or by movement, a lot of that is like you just said, isn't it? But can you explain a little bit as to why movement? Because I think traditionally, if a dog was sore or a person was sore, it was very much like bed rest. Don't do
right,
anything.
right,
Just don't aggravate yourself. But actually, we now know that moving is really important
right.
to keep yourself pain free. So, what's the sort of thinking behind that with rehabilitation exercises to try and reduce that inflammation?
If we look at, because certainly, I mean, years ago, it would be a person hurt their back and it would be bed rest. And
Yeah,
then we started to understand that how detrimental that was, because you have all the atrophy occurring and the lack of synovial fluid flowing through the joints, or the oiling of the joints. So when we look at appropriate movement, and I always say we don't want to follow that no pain, no gain, because we don't want to cause pain.
no,
Um, so we want to be careful with it. But that little bit of movement, and I think, for anyone over the age of 40 in the audience, when we get up in the morning and, we're kind of stiff and we spend a little bit of time, probably like not even thinking about it, doing some stretching and starting to oil up the joints, if you will, start
yeah,
to gain some mobility, and that just starting to get with that movement, especially in cases of arthritis, you start to get that rich synovial fluid flowing, you get that contraction or the compression and release of the joints. So everything starts to feel better. And sometimes it needs to be facilitated. Like we may take a hot shower in the morning to get going. With the dogs, definitely like the modalities such as the laser, the photobiomodulation will facilitate that. So that's always lovely to do.
yeah. And the lasers are great, aren't they? Because so many people can have them at home now.
Yes, yes. And there are a lot of companies, like we rent out a class 1 laser that is wonderful for home use, and owners can rent it for a couple weeks, and very often that kind of kick starts, so the animal is feeling better, and then they're able to do more and more at home. So
Yeah.
it's great.
So when you see an animal, do you often, if you know, for example, that this dog has got hip dysplasia, but they're showing a lot of spinal pain
Yeah.
or lumbosacral pain, and are you often trying to combat that first before you go for the
Yes.
actual problem?
So definitely. So we make a list of the primary problem, secondary problem, tertiary problem, and they may very well have hip dysplasia, but that maybe initially most of their pain is coming from their lumbar spine because
Yeah.
they're compensating, or from their shoulders or their cervical region because they're compensating. And as that starts to feel better, then we could move to a different area and reshift our short and long-term goals according to what they need. So
Yeah.
there's always going to be that strengthening, but again, we're not going to get those hips stronger unless we get the dog moving better.
Yeah.
So if we can put them in water and focus on walking nicely and starting to help there, that's fantastic.
And what age groups are you mostly dealing with? It is sort of the older. How much of your workload is the arthritic dog?
I would probably say I mean, a good portion, and I'm always like, so it's hot. I know it was hot in England when I was there, but
Yeah,
we have,
it's not normally like that.
yes, like the hotter weather, but like thinking about our winters. So winter, we want to get these arthritic dogs better, before the cold
Winter.
weather comes in, because there's inadvertently a decrease in activity. So I'd probably say more than a third, if
Okay.
not a half of our patients have osteoarthritis.
Yeah. Yeah. So this puppy that you were just talking about, and you say it was a 10-week-old puppy with the elbow dysplasia?
10-week-old puppy, a golden retriever puppy that the breeder noticed off the bat was doing something, wasn't walking properly. So radiographs or x-rays taken and shown that the elbow has some malformation issues, and due to the age, surgery is not an option right now, maybe in the future, but the breeder's being very proactive, and the goal is for this puppy to, you know, live, like I always say, the best quality of life for the longest time possible. So working, like we started today just with some pain control and excuse me, working on like some low level activities, because it's a puppy. We still have to respect the growth plates and all of that. So, but just beginning really slowly. He went in the water today and just walked the water treadmill and, you know, did some things. So, you know, and also educating the owner about not letting the puppy jump down. And I mean, it's a puppy, so they're going to do idiotic things.
This is it. What can you get a puppy to do? It's
exactly, you know, so, you know, let's just modify their life. So let's not have him, you know, run down the stairs, not jump off of things, you know. And I always tell owners, I have 2 dogs of my own, and I wish I was sometimes better about, you know, not having them jump off a couch or something like that. And it's difficult, but if we can at least control their environment half of the time, that makes a difference.
Better than not at all.
Yeah, and I find that that's more manageable. And, you know, rather than tell owners never, you know, have the dog chase after a squirrel. Well, they're going to chase after a squirrel.
Yes. So, you know. Just do the best you can. Do you have any tips for getting dogs to sort of concentrate and be prepared for their exercises?
Yeah. So I try, especially a dog that is so active and owners are really struggling with, we recommend a lot of enrichment activities. So like snuffle mats or licka mats, and this can follow along if the dog is older. I love the snuffle mats because it helps with the respiratory muscles and sniffing and, you know, helping to strengthen, but we can also combine it with them standing on something uneven. So we're getting a bunch of things going on, and they're eating their food because their food is being put into the snuffle mat. But lots of maybe like hiding food, hiding treats, and working with that. So they have to kind of work for it, but also, you know, and we often think that a dog needs to be physically exhausted, and we forget about the mental aspect. You know, so working with different things is, you know, often very good. And, you know, taking them on a controlled walk, but having them work during the walk, and, you know, sit to stands or downs, and adding things into that is, you know, great to do as well.
So you're kind of just involving it into their daily routine rather than making it into a 20-minute session of this is what you're going to do.
You know, I think about with my own dogs, if something's in front of me, I'm going to be more apt to do it, or if I can fit it into my everyday life. So, you know, if I want the dog to perform sit to stands, I'll ask the owner, you know, when you're going outside, before you go outside, ask the dog to do 3 sit to stands. Or, you know, before you feed the dog, you know, most of us feed the dogs twice a day. So incorporate the activities into that. And, you know, that helps. So it just makes it, the owners become more compliant with it, rather than, okay, you know, I have to set aside this amount of time to do this. And, you know, it's definitely can get exhausting.
0 achieved.
Yes.
And how do you, when you start these kind of processes or programs with people, how do you get people to monitor, or do you just rely on, you know, the video calls and coming back?
I will usually have the owners document, you know, maybe, you know, email or in an Excel sheet, you'll keep track of things. And, you know, cell phones are always so great. So can they just monitor their cell phone and tell me how much activity they did? So set a timer. So, maybe on Monday they did 11 minutes and, the next day. So we're going on the up, understanding that there'll be, maybe a day that things will be slower, or the weather's bad, or it's so hot, and, so things are a little bit, less.
And do you have do you create contingency plans, I suppose, for dogs when they're having, because we all know anyone with an arthritic dog is very aware that they can be having a few really great weeks, and then you feel like, oh, this is it now, this is the end, because they're having a really bad couple of days, but it's an acute flare up in majority of cases. So do you then make those plans right from the beginning, because so many of them do have these trip ups?
And I think, yes, definitely. So education, and I use the analogy with osteoarthritis. This is a chronic condition. And if someone has a sunburn, so you have this underlying sunburn, it's there and it's just always there. It bothers you, it hurts you, and, it can get better, but it can be flared up if someone grabs you and grabs your arm, because that can cause a lot of acute pain. The same thing with a chronic headache. You can have this headache all day long and be doing okay until someone slams the door and it just, you explode. So, having owners understand this is a whole disease process, and, we may go up and then kind of plateau and then settle down and all of that. But what to do when there is a flare up, because it may be, a lot of different things. I find that so many arthritic dogs start to feel so much better, and, maybe they thought, okay, I can't chase that squirrel, but now I can.
I'm going to try.
And they overdo it, and then they're sore, and then it's just, just a step back, and then, progressing again. So,
I think it's really important, isn't it? Because I think sometimes, when that happens, people almost don't want to say this has happened, because they don't want anyone to say, well, this is probably it then. This is when we need to think. But if you have a plan in advance and you're prepared for it, then you can deal with it a lot better.
Absolutely. Absolutely. And it happens, and it's, emotional, and none of us want to see our animals hurt. And, when that happens, it's awful, but it will happen, and it will, get better. And, I know we're going through this kind of thunderstorms and high humidity, and I'm trying to warn all of the owners that this is not great for arthritis.
Will have an impact. Yes.
So understanding, hey, it's going to be, we're going to have thunderstorms. So it's, going to throw everyone off. And, that's kind of normal. And if it doesn't, well, they're prepared for it. So,
yes. And preparing for every eventuality. So when, do you get most of your patients, do they come in via other veterinary practices, or do people come to you and say, look, I've got an older arthritic dog, when should I start these kind of exercises?
So most of them are referred in. We do have a lot of owners that will call and say, hey, I want to do this, and we'll make sure that they have a clear, vet record. There's nothing else going on. Especially with the older dogs, not everything, they may have arthritis, but there's something else going on. And so, they want to jump ahead, or they definitely want to assist with, again, their, quality of life, or their dogs they've noticed that they have put on weight, and, they want to, be proactive with it. So, which is always great. I mean, I would much rather an owner be proactive and, just say, hey, I want to come in once a month forever, and, just if everything is off, and, that's great. That's perfect.
That's the dream, really. Because I think as an owner, it's when it's your pet, it's your member of your family, you know your pet better than anybody else. So if you're noticing changes, then it's never too early a time to start this kind of intervention, is there?
Exactly. And it's always, I really, whenever I educate owners or talk to dog groups, I highly recommend keeping a journal and take photos. And no matter how old your dog is, just start and what their activity level is like. Because if we look back and say, well, 6 months ago I was hiking 5 miles with my dog, and now we're only doing a mile, or
Right.
so what has changed. And just because they have arthritis or they're getting older, that doesn't mean that they should hurt. I think society just has that, with people too. Oh, they're old, they should hurt, and that's not
It
as
doesn't have to be that way.
Not at all. So
And I think there's a massive shift with that, because it used
yeah,
to be like when I first qualified, a dog would come in maybe for its vaccinations and it would look very stiff, and very painful, and owners just kind of ignored it because they said, well, he's 13, so he's going to be like this. And we would just go, yeah, he is. And now I look back and I think, oh my goodness, I was those poor dogs. I didn't even push it. And I do find it very difficult for vets and people that aren't in rehabilitation centres and physios and hydrotherapists and people like that, trying to point out to people that their dog might be in pain, because maybe they're not limping, which seems to be the thing, or even if they are limping, they still want to chase that squirrel occasionally. And of course they will, because they're a dog, and that's more exciting, and then they'll deal with the pain later.
Absolutely.
And it's really difficult to explain that to people, that actually their dog is in pain. And I just hope that more and more people watch this kind of thing and then aware that maybe there is, and you don't have to spend thousands of pounds. There's so much that you can do at home. That's really going to help your dog.
Absolutely. And it's so true. I laugh that I could sit in a general veterinarian practice and point out the dogs that are in pain or they're having trouble with movement, and that would be appropriate for, and it may not rehab for life, but just pain management or joint supplements or anything. It's so much more prevalent. And I do tell owners, your dog's better than anybody else in the world. So if you notice, something, then it's important. Anyone that works with dogs, I talk to our, the trainers that we work with, that if you notice aggression, if you notice the dog's not moving right, they also have, just such a good eye for things. And trying to, educate. And for the most part, I think owners are receptive, but you definitely get some of those owners that are like, oh no, not limping, they're fine, they're, good, everything.
Yeah. I mean, Debbie's actually kind of said along those lines, it's really tricky for dog trainers who see dogs in discomfort in their classes. And it is, it's a really touchy subject, because if you bring it up with that person and they really don't want to hear it, well, then you've actually lost a client, haven't you? You've lost some work there, and that's a hard one to deal with. I mean, maybe they shouldn't be in those training classes if they're painful anyway, so probably it's a good thing if they did go. But yeah, you want somebody to jump on board and say, here's what you can do, go away and look at this. And I know that you obviously do a lot of teaching, and I think it has to come, I don't know how we spread the word more, like where it has to come from. Is it dog trainers? Is it breeders? Is it vets? I don't really know where we have to intervene to get this more out there more.
I know. And I think, again, like the more that we could educate others and get it out there, and if there's the like poem about the starfish, like all the starfish on the beach and a little boy throwing one by one into the water. And I think an older gentleman says, you're not going to make a difference to all of them, but he says, to everyone I throw in, I'm going to. And, so I think about that. And, if we can, again, the more education, the more, even like friends, like if you see your dog, your friend's dog limping or uncomfortable, say something like, hey, it may not be like, again, much, but, definitely helping.
Yeah, the more we can get out there. So if anyone's watching and is a trainer or a physio or whatever, and I think it's just sometimes just stepping up, isn't it? Or some of the nurses I work with at work, they are very good with telling people their dog is fat,
Yes.
which is always something that I find very difficult, because you don't want to fall out with people.
Yeah.
So it is like things like saying your dog is overweight, your dog is lame, your dog is
Yeah.
is painful. These are really, really difficult conversations to have with people. And I think a lot of the time they are aware, owners, but they just emotionally like blocking it out because
Right.
they think that this is the end of the road. So
Right.
it's so important to try and get out there that this is not the end of the road. And actually, from
Right.
what you've just said, some dogs come into rehabilitation and or to your centre and actually improve to the point where they don't need to keep coming back.
Oh, yes. I mean, I always tell owners, that's the goal. We
Mm.
may start off once or twice a week, but then the goal is to wean the dog off so they're independent on a home program. Maybe a device at home, or they're checking in once a month or something like that. But certainly that's the goal. I mean, we have some dogs that no matter what, the owners just feel better. They come in, they
Yeah.
want, and that's, great also. So, it's whatever fits a little bit makes a big difference, especially in these dogs. So
So
definitely.
how when they come to you, how often would you get them back onto the tools that you use? Like
Mhm.
I don't know the name. What did you say at the beginning? That I know exactly what it looks like. Where you get them to walk on it and you can map
Yes,
out
the
how they're
dynamic gait
doing.
analysis. Um,
Yeah.
so we'll typically retest usually every 3 weeks. So
Really? Okay.
thinking about, if it takes an honest 10 to 14 days to make an improvement, with compliance and all of that. So, looking at that would
Mm.
be, you know, good. And I mean, there are times where I'll do it before and after treatment. So, to
Okay.
see, the improvement, or, what have we done and what does everything look like. So, yeah,
Yeah. I think that's quite nice for owners to see because then they've got something in black and white, haven't they, to show that what they're doing is
exactly.
actually
Yes,
definitely making a difference. And you can,
absolutely. And you can use like a tool like the digital thermal imaging, which demonstrates temperature changes. And that also is a very nice colorful picture for the owners to see.
mm,
And again, doing it after the treatment to see the benefit. And I find it very useful too with determining, so to show owners, look, your dog is in some discomfort, and here's an objective way of looking at it. So,
yeah,
you know
yeah. Because
but
a lot, I mean, I was talking to somebody about this earlier, but when you're sort of grading things, it's very difficult for everybody to grade things the same way because it's very subjective rather than objective. So to have those tools that you have that can really
yeah,
show, I think it spurs people on to do more as well if they can see
yes,
that they're succeeding.
yeah, definitely,
And
definitely.
how many of the dogs that come into you? Because somebody's written up here about Dawn's written. Can you recommend a laser to purchase for at-home treatments? Now, I don't know if the lasers in the States
Mhm,
are the same as our ones, if they're the same
mhm.
companies.
Yeah, I don't know. So Don, you can look, um, and I'll be glad if I'll put my email into the chat if anybody has questions.
Oh,
But
brilliant. Thank you.
there's a company called Respond Systems. So they're in the U.S., but I know they sell throughout the world.
Hmm.
Another company that we sell and rent lasers is called Multi Radiance, and so those are both very nice and safe options for owners, and we have quite a few owners that will, reach out and purchase those. So yeah,
Yeah. I mean, I know there are definitely some out here because I have clients that have got them at home, but I
yeah,
wouldn't know what names they were for
yeah, yes. So
them.
those are two of them. Yeah.
And then we have Witchy Nurse Francis. Ignoring pet pain is even worse in cats. Do you see many cats in your?
We do, and I definitely think cats are more of the silent sufferers
Mm,
because we just assume they're, spending 20 hours under the bed, and they're, we just kind of ignore them. So we do see a lot, and they're a big difference very quickly. And they don't always do well in the clinic, like the rehab
No.
setting. So very often we're setting them up on a home program. They're the ones that they're renting a laser, or, and the owners do great at home and, with them, and they feel so much better. So yeah, definitely.
And what are there some breeds of dogs that you see that you feel are quite good at hiding their pain?
I think a lot of the working dogs will, whether they're Labradors or Shepherds or Malinois, that have been just used to in a working environment, and they'll tend to be more stoic. I laugh that some of the smaller dogs tend to be more dramatic,
Yes.
but, yeah, but it'll, and the
Varies.
attachment to the owner. So I have working with a wonderful team right now, and this dog is the assistant's dog, and I think he puts on a tough face for the owner, so,
Okay.
so I look at that, and that's,
Yeah. Yeah,
so,
that's hard because what you see and what they see is
right.
obviously not the same.
Right, definitely. And I've been actually during the pandemic taking the dogs away from their owners, and then
Yeah.
watching their activity has been very interesting. And I think definitely more beneficial for me to help the animals and the owners. So yeah, that's
Yeah,
been,
without that influence.
yeah.
Yeah. Yeah. I guess now it's back to normal though, is it? People are coming back in and
You know what? We're still, because we're a smaller area, we're still not having clients come in. And
okay.
not for the pandemic anymore, but it's allowing us to focus more on the animals. And, of course, we talk to the owners and all of that sort of stuff. But,
Yeah.
rather than me chit chatting with an owner, I'm able to concentrate so much
Yeah.
more on the animals. So it's kind of been nice.
Yeah, I mean, there have been a few good things that have come
Yeah,
out of the
yeah,
pandemic.
definitely.
And that is obviously one of them. And that,
Yeah.
that's really good. Now, this is a good question because I don't know anything about this.
Yeah.
So Dara's written, is the CC loop as good as the laser? Can you tell us, because I don't know, what
Yes.
is an CC loop? I know you mentioned it earlier and I was going to come back to it.
So the CC loop comes from a company called CC Animal Health, and it's targeted pulsed electromagnetic field therapy. So its aim is the same, to reduce pain and inflammation. It's also great to work on wounds, and the loops are put on or around the area that needs the assistance. So, and the treatments are, I think, 15 to 16 minutes long.
Okay.
And it helps to, again, reduce that inflammation, great for home use.
I was going
And
to say, is that safe to use at home as well? It
yes,
is.
so that's 99% of the use that we have of them are for home use. And
Okay.
the companies began making a CC beds to put in cat carriers for, so cats go in with their arthritic cats, and, to help. And then they've been making larger beds. So the animals lie on these PEMF beds and get the benefit of the pain
Wow.
control, all of that. So, and what I found is interesting is the animals were always seeking them out.
Really?
Yeah. Which,
So do you have some at your clinic? Do you use them?
yes. So we have a lot of the CC loops. We use a PMF bed by Response Systems, the same that does the laser. And it is interesting. I've noticed with my own dogs, we'll seek it out. So it's,
So even if you don't have a painful dog, they just seem to prefer
yeah,
that because it does obviously something to make them
correct.
more comfortable.
Yes.
And actually, that's another thing. I don't know. I mean, I guess it is part of rehabilitation. Sleep.
Yeah.
Having a good sleep is so important.
Absolutely. And if you think about these, if they're older dogs with arthritis, and they're also starting to have some cognitive issues, and if they're not getting that restorative sleep, there are going to be issues. So, looking at that as well. So thinking about, are they on a good bed? Are they, comfortable, or you watching them at night? Some owners don't sleep with their, dogs. Their dogs are in another room. So, are they getting that benefit of that good sleep? I mean, I know I'm grouchy after not
If you
sleeping.
don't. Yeah. Yeah. And it is something that some people do mention, that, the dog always used to come up the stairs to sleep with them at nighttime. And then they were getting on the bed, and maybe they can still get up the stairs, but they don't want to come on the bed. And maybe that's because people are moving. And then when they move, that's moving them, and that's painful. And there's so many tiny little things that when you add them together, people think, oh, it's hot, so that's maybe why they're not doing it. And maybe it is, but it might be significant. So, I mean, are you very much an advocate of any little change? Maybe what is worth mentioning.
Absolutely. So if the dog is not going up the stairs, is that, do they not have the strength? Do they not have the extension? So absolutely. So any, little thing, or they're not jumping in the car, or, they're avoiding walking on the kitchen floor because it's tile, or, something like that. So I think it's always, I'd rather nip it in the bud or jump faster rather than it fester and become, more of an issue.
Yeah. Because the longer, I mean, like you say, when you don't get a good enough sleep yourself, you're being grouchy, and the longer you're grouchy, the longer you're tired, the longer you're in pain, the harder it is to break that, isn't it?
Absolutely. Yes, definitely.
Early intervention is key with all of these dogs. And
definitely.
Having a look through there as well. So this is a good point, Debbie, that you've written here. When owners realize the support is out there, they become so empowered and positive.
Yes, absolutely. And knowing that they're not alone, they're not the only ones going through this. And, another positive that I've noticed with our owners are out in the parking lot, and so many of them are talking to each other and the support network. I'm like, oh, this is great. One of the owners today said, oh, you should open up like a bar out here. I'm like, I'm like, oh, okay. But it's nice to see that they're talking and sharing things, and it is wonderful. And it does. I mean, knowledge empowers. So just understanding, and that's great.
Do you find that with a lot of dogs that come in, people are searching for that information? I guess you see the percentage of people that are really keen to do everything they can for their dogs. So
I think for the most part, most people they want more, and depending upon the different levels of what they'll take in, absolutely. And very rarely do owners just say, I don't care, just fix them. We do, do have that. But I think for the most part, I feel like we do such a better job if the owners understand, what to do, the ramifications of different things and all of that. So absolutely.
And do you have some people give up and just say, we can't do this, it's not working for us?
Yeah, I think depending upon their household and what's going on, and some owners can't. They're just not equipped to handle a dog that's having issues, or anything like that. So,
but very few, I would imagine.
Yeah, I think for the most part, the owners that we work with are incredible, and they're so great with everything that they do.
Go the extra mile.
Yeah.
And so since you started doing this, what kind of things have come out for you? Would you have started using, like 25 years ago, would you be using the laser and the CC loops? I guess they weren't really.
I think that every year things seem to advance, and we're learning more, we're trying more, we're finding different combinations work. And so definitely, I think nothing will ever replace manual work, like massage and mobilization and all of that. But I mean, there's so many tools that are non-pharmaceutical, so non-medications that owners can use at home, to do things. I mean, again, breaking that cycle somewhere. and then getting the animals feeling better and, watching that restoration occur. So,
Yeah.
I mean, it's been like, I've loved just watching, the changes. It's incredible. So, yeah.
So what would you say to people that are watching with their dogs that currently are just maybe on some pain medication, but really want to do more? Because those are people that obviously watch our lives and want to do more. How would you? We do have rehabilitation facilities in the UK, but yeah, I mean, how would you? What sort of tips would you say about starting off? Speak to your vet first, or
Yeah, I would definitely. So I joke with my referring vets. I'm like, whenever if an animal is on pain medication or a non-steroidal NSAID or a steroid, definitely factor in the other components. So it's one thing will decrease that pain and inflammation, but we're not going to complete that circle unless we increase their strength, range of motion, and function. So really, if any animal is on any kind of pharmaceuticals for longer than 10 days, so something's going on there, and definitely to help. And again, with that chronic pain, thinking about repatterning and making changes would be fantastic.
Yeah, I think we definitely need more rehab facilities here.
It's not, or even sometimes like, I know I do a lot of consults like all over the world, and it's just, this is what our dog needs, and here's some basic things to, make the dog more comfortable. And, sometimes, as I said, it doesn't take a lot. It's just a little bit. So,
even doing a little bit is better than nothing. So what would if you were to give 5 top tips for things that people could do at home, just to start that kind of supportive care and watching their dog at home, what would I don't know if there's 5 that you would say?
Yeah, so I would say, sounds so simple, but walk your dog. Even if you break it up into around the block or 5 minutes a few times a day, just that is such an important, so great for the dogs and for the owners. Be realistic about their weight, so, look, and if you need help, if you think your dog is overweight, seek help. With that, don't, you're not alone there. Do enrichment activities. So if it's sniffling or snuffling or nose working for some activities. I also like simple balance exercises like walking in figure eights. Help so much with flexibility and core and strengthening. Then the other thing, as simple as it sounds, I mentioned a dog standing for 10 seconds. So having them stand for 10 seconds and look up without sitting. So that looking up will transfer weight onto the hind end. And if owners feed kibble, a great opportunity to do that is to hand feed them 10 pieces of kibble while they're doing that. And then if you're fed, the dogs eat twice a day, you get 2 sets of exercise in. So it'll work out nicely.
Yeah. So would you like just get them to feed, to stretch their neck up, but also to side and down?
Yeah, absolutely. So to do a little bit of weight shifting and but
just really simple things
make a big difference. Absolutely.
So do you do video consultations with people in different countries then? You do?
Absolutely, yeah.
Oh, that's interesting. So, if anyone wants more information, then
reach out.
Wizard of Pets,
Wizard of Paws. You can.
Paws,
my email is deb@wizardofpaws.net, or you can reach me on Facebook or whatever works.
Because there's so much you can do online, as we've learned through the pandemic, that we can do this. And even if you're not doing those benchmarking things at the beginning, it doesn't really matter. It's nice to have them, but it's not essential.
Yeah, definitely.
I will just bring up, I don't know what you feel about the Big Barker beds, but Big Barker sponsor all of our lives, and we
love Big Barker beds. We have them all over our clinic, and we're when we're talking about like good restorative sleep, I mean, this is something that could definitely help. And we actually have one in every one of our treatment rooms, and my
Wow.
dogs have one at home. So
Yeah.
I love them. Yeah.
And can you put, you were talking about the CC equipment, do you put them on top of those
You
beds
can
then?
definitely put that on top. Absolutely. And the
Okay.
big barker beds will find that the dogs will come into the clinic and they'll go right over to their bed, and
Yeah.
they will sit there, and they're nice and comfortable and just a very impressive company. So I
Yes.
cannot speak more highly enough of them. They're just great. So
Yeah. Well, we do have competitions where we give them away on our Facebook page. So
oh,
for
okay.
anyone who doesn't have one, keep an eye out on the Facebook
Yes,
page.
they are great. So definitely.
Yeah. So yes, but please do that, because they are all part of the process of keeping your dog comfortable.
Yeah.
So I'm going to let you go because I'm very aware that this is sort of your
Thank
lunch break
you.
there. But thank you so much for joining us.
Thank you, everyone. Yes.
And if anyone does have any questions, I'm going to put the link to your website, Wizard of Paws website, and all that information. So if anyone does want to follow up, then please do. That'd be great.
Okay, that sounds good. Thank you so much, Nikki. Thank you, everyone.
Have a lovely evening to everyone watching. Thank you for joining us, and we'll see you
Bye-bye.
again next time. Bye.